Hello, good morning, Letitia. How are you?
Good morning. Good, thank you. I'm fine. How are you?
I'm good, thanks. My name is Pradeepa,
Yeah.
and I'll be your trainer today.
Yeah.
So this is a recording for TAEDEL402, coaching session number 2, donning and doffing of PPE for airborne precaution patients. I'll be the trainer for you today. We'll be teaching you the donning and doffing procedure for the airborne precaution patients.
Yeah.
Can you introduce yourself, please?
So I'm Letitia, and I'm currently working in B44 gastroenterology, and I do have past 8 experience in community health nursing.
Very good.
Yeah. So I'm looking forward for this session.
Lovely. Thank you for that. I was contacted by your manager, and they said that you have started to look after patients with additional precautions. So you need an extra bit of training because now it's an acute care setup. So that's the main reason why we are doing this session. Okay.
Yeah.
So basically, what we are going to go through is a few housekeeping rules.
Yeah.
So if you have a pager, you can just put it on silent or you can turn it off. Same with the phone as well. You can put it in silent or you can turn it off.
Yeah.
And if you get a phone call, you can go outside and you can attend the phone call. I'm all right with that. Fire exits, as you can see, if you walk out of the door, onto your right side is the green man running. You just need to follow the sign, and down to level 3 is your evacuation assembly point. Okay. Your tea rooms are just on your left side, and the toilets are straight opposite to the room. Okay. So with work health and safety, is there any issues that I need to know when it comes to your ergonomics or anything that would be hindering your training?
No.
Nothing. Okay. So are you okay with the materials that I would be using, your hand hygiene, any allergies that I need to know? All right, lovely, thank you very much. And so the content of the session would be, I would be going through the principles of donning and doffing, especially for the airborne precaution patients, and what PPEs is required for this procedure, and then I would be doing a practical demonstration. Okay. So you can watch me as well as I'll give you handouts, plus there is a display on the board as well. So at any time you can go back, let me stop, you can stop me, you can question me, and I'm happy to repeat the procedure. But if you're perfectly good with that, you're confident, you can go ahead and do your one more practice, or you can go ahead and stay to your competency in the end. We will do one competency in the end. But at the same time, the same session would be repeated next week as well, same time, same day, next week, just to reinforce the knowledge. And on top of that, other assessments would be when you go back to the ward, when you are doing the donning and doffing procedure for airborne precaution patients, you need to let your CNE know about it so that they can come and do an assessment on the floor just to see whether there is transference of knowledge from what we learned in this session onto the floor. Are you happy with that?
Perfect.
Shall we move on?
Yeah.
Good. So I found out from your BAK, learning assessment tool that you are done, that you are scoring more towards a visual learner, and then secondly you are a kinesthetic learner. So you have to see things and you have to do things. And lastly, you are an auditory. So I'll try my best to talk less and do more things and show you more things. Okay? Good. So the main thing is, why do we need PPE? So I'll be doing some questions and in between questioning sessions as well, just to see what prior knowledge you have got. So feel free to answer if you know about it. I'm pretty sure your knowledge will be really great when you have worked in the community. So why do we need PPE? Why do you think we need to use personal protective equipments and additional precautions when we need to go to patients who are infectious?
Just to reduce or stop the transmission of infection.
Very good, lovely. Especially in the COVID situation at the moment, we have to be very careful and we have to use the proper PPE, and the mask has now become part of our body now, and we have to start using it, and the same in the public as well. So that's the reason why we are wearing PPE. And depending upon how the microorganisms are getting transmitted, we have to use the correct PPE, and we have to choose the right PPE. So today we are going to look into airborne precautions. So airborne is the microorganisms are going to travel through little aerosols that is less than 5 micron in size, and it's going to be just suspended in the air. It's not going to settle down much. Yes, it does settle down. You can come in contact with it as well, but at the same time it's very easy for you to breathe it in. Now can I just ask you, what PPE, you got your choices here. What PPE you would be wearing?
For my airborne precautions?
Yes.
Okay. So definitely my gown.
Yes.
My goggles, gloves,
Yes.
N95 mask.
Okay. Why N95 mask?
Because N95 has it is more reliable than as opposed to a surgical mask, because a surgical mask is protecting others from getting what I would have.
Yes.
Whereas this one is a bit of both.
Very good. Well done. So that's great. Beautiful choice of your PPE. So when you're looking after the patients with airborne precaution, you need to put your contact as well as airborne precaution sign on. Plus, these are some of the handouts that I've got for you, so that you can follow the steps when I'm doing the donning and doffing. Okay? So the first thing would be my hand hygiene. Oops, sorry. So my 10 steps of hand hygiene. Okay, good. There below the elbow. Then I will pick my gown. So you can scroll down if you want to look in the one as well. So with this type of gown, I should not be tying it in the front, but the side is fine. Then would be my N95 mask. So I will just pick an N95 mask, hold it like this around the chin. Make sure I don't touch the front of it too much. The top one, and then the bottom one. Make sure you get a very good fitting there. Okay, nice and breathe in, breathe out. Breathe in, breathe out. You should not feel any air coming out. Okay, and then my last bit, or actually one step before, is my goggles. And then another 10 steps of hand hygiene. Okay. And finally, my gloves on. Okay, this is my doffing. Okay, big method, off and off, inside the brain, hand hygiene 10 steps. All those things, and next would be my gown. Okay. This should happen inside the room. Leaning forward, just lift it, touching from inside, roll, 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 inside the baby. Hand hygiene again, can set 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, over 20 seconds. You come into your empty room now. You can take off your goggles, clean it with thinner wipes. little penny. I'm going to reuse it for training purpose, so I'm just going to keep it here. Are you happy with this darling and dolphin?
Yeah.
Are you ready for it?
Yes.
Lovely. Okay, I'm going to give this to you
Yeah.
on that side to practice. And are you happy if I do the competency at the same time if you're confident?
Yeah.
Lovely, beautiful. Let's do it.
So firstly, I'll do my hand hygiene.
Yes.
Now next step would be my gown.
Yes.
So I'll do my gown. And this would be in the entry room. I'm gonna do my hand hygiene.
Okay.
And one more step, because I already have my mask on,
Oh.
which is a surgical mask.
Yes, yes, yes.
So I'm going to doff that off first.
Very
and
good.
put my
Lovely.
mask on.
No problem. Well done, Nitisha. Good job.
I'm going to do my hand hygiene again.
Sorry, just open that one.
Alright, so the next step is my mask,
Yes.
which is my N95 mask. So I've got 2 strings there. So we have to have that posture right
Yes.
to put the mask on.
Exactly. Beautiful.
Just breathe and adjust the mask. There's no leak.
Lovely.
Okay, I'm going to quickly do my hand hygiene again. And then I'm going to wear my goggles. So once I've got my goggles on, I can wear my gloves.
Yes.
And that glove should be above over your gum. And there we are.
Lovely. Beautiful. Now, if you can do the doffing, please.
Sure.
Yeah.
So, like you mentioned earlier, you have to do the beat pattern. So, I'm gonna.
Oh, I'll just swap around with that, please.
this will be in the entry room.
Yep.
Can I do my hand hygiene again? Okay, so gloves it out, now lie down. So inside out. Rolling inside out.
Beautiful.
Can I do my hand hygiene? So the next step is my vocals. Once I've taken my vocals, I'm gonna take the wipe and clean with normal wipes. And hand hygiene again. Okay, finally the mask. So I have to have that posture again, looking straight at it.
Okay. Continue, Nitisha.
So I've completed my hand hygiene. So I'm going to take my mask off.
Yeah.
So we have to stand up straight,
Mhm.
have our head straight. Looking straight. I will dispose this in the bin, but
Yes.
for the moment, I'll keep it with me
For further practice.
for further
Yeah.
practice and
Yeah.
education.
Yeah.
And I'm going to do my hand hygiene again.
Beautiful. Lovely. Thank you very much, Nitisha. Have a
Thank
seat.
you.
You have done so well.
Thank
I
you.
think you nailed all the steps, and I'm going to pass you in this competency.
Thank you.
Well done. So, but we will be again meeting next week to do just further more practice and more competencies. In the meantime, I will just give my email and my phone number would be there in the email as well. I'll send all these resources to you so that you can practice at your own time.
Yeah.
You can take a photo of these resources, which is going to help you out as well in case of need. And when you're doing practice in your ward, how about you just let your CNE know so that they can develop that portfolio that you've been doing it at work as well, and sign you for the competency and submit it to me. So keep in touch. Any questions you have?
No.
All good? Beautiful, beautiful. So if you have any questions, please email it to me. So this rapport keeps going on. We have to keep in touch. I have an evaluation form that I've given you, which says if you can please complete it for me.
Sure.
Lovely. Thank you so much.
Thank you.
Thanks, Nitisha, for coming over.
Thank
you. Thank you.